And it says we are starting, and yes, we are live. Okay, sometimes I'm not really sure if that is happening. I'm just gonna double check it here on our Facebook page that it is live, and it is. Okay, so yay for technology working. And Maddie, thank you for joining me for this live. For people joining us, if we haven't met, my name is Julie Hirschberg. I'm a neurologic physical therapist and the owner and founder of Reactive Therapy and Wellness. And Maddie and I were kind of reminiscing and trying to put the pieces together, but we actually met almost 2 years ago in the midst of the pandemic. We met online. To chat about our concussion treatment program. And she recently completed our program. And so it's always so fun for me to see that progression from before to after. And Brittany Charlet, our concussion program director, connected us to chat. To share your story, really, Maddie. So thank you for being here and doing that with us. And it would be really great. People always want to know about you and who you are and what you're about. And if you could share a little bit, or as much as you want, of your story with people, that would be great.
Yeah, so my name is Maddy. I'm happy to be here. I live in Philadelphia. So basically, I've been an athlete my whole life, and I suffered a concussion, one of many, senior year of my college career. And it was a whiplash neck injury and concussion. And basically, I had multiple concussions prior, like I said, and most of those injuries would heal over like 2 to 6 weeks, probably. And then this last injury, the symptoms just progressed over the years instead. So, since I was 20 at the time, since I was 20 and I'm now 27, I've been just kind of circling the healthcare world trying to figure out how to heal my symptoms because I've tried so many different modalities and like physical therapists, occupational therapists, massage therapists, acupuncture, dry needling, and many, many more. I've tried everything 3 to 6 months at least, to see if they would work. And basically, I just was in a continuous circle with this chronic pain. And yeah, so basically, the symptoms like took over my life. I had to defer grad school many years. I had to stop personal training. My social life got really small. Just things really, the symptoms took over my life basically, which is what happened. So now I'm in a different place, but I guess I'll talk a little bit about that soon. But I'm currently in grad school and I'm graduating in June from Drexel with a human nutrition degree. So
Yeah, which is so awesome. Just love seeing you get pieces of your life back. And so you had experienced multiple concussions, had tried many things, and I think your story is really common for people because concussions are a bit of an enigma and complex. And I'm curious, how did you find us, and what drew you specifically to our integrated approach?
yeah, so I found you guys on Instagram. When I have long periods of a lot of pain or a lot of symptoms, I go on this rampage through the internet trying to find somebody new to help me. So one of those nights I was looking up the hashtags of like concussion programs on Instagram because I figured like companies use hashtags, you know? So that's how I found you guys. And I was drawn to the integrative approach and like everyone working as a team because I've tried a lot of the modalities you guys talked about in the Facebook lives you had or Instagram lives maybe. Um, and the information you put on your page, I just could see all the things I tried, but all in the same place. Um, Not every single thing, obviously, but just seeing how you believe that a team approach is the best. And I always thought that, and I didn't know if it was because I'm like part of teams my whole life, and I'm just like, yeah, we need everybody. But um, Yeah, I was drawn to just knowing that the program seemed very organized. Everyone seemed very educated. It wasn't old medicine with concussions. Because like when I got my injury, it was still like go sit in a room in the quiet, and I was like, that didn't work for me. Um, that didn't work. So I knew like the science was starting to change. So when I saw it on your page, I don't know, it just clicked, and I was like, oh, they actually know what's the newest way to treat this, and can apparently has like successful stories. Yeah.
Yeah, yeah, that's great. I appreciate that you use the team analogy too from sports because you're so right, right? Like you could never have like a successful win with just like one person on your soccer team, right? Like you need every position, you need those different specialties, and they need to talk to each other, right? Like there needs to be a lot of communication and coordination to put those pieces
Oh, you
together.
know what
So,
else? Sorry to
yeah,
interrupt you.
yeah,
Um,
please.
you were addressing the nervous system on your page, and, like, I feel like a lot of doctors would make me seem like I'm crazy or my symptoms are, like, in my head and things like that, but I saw how on your page you addressed, like, the autonomic nervous system, I guess, like, sympathetic, parasympathetic on this, like, pie chart, and before there was a pie chart, but, um I didn't know a lot about it. I just knew that something was wrong with also my nervous system and the way I interpreted like my pain and the way I was breathing and exercising the intolerance up to it. So that's what really got me. It was like knowing you that most people aren't talking about that.
Yeah, yeah, thank you for mentioning the pie chart. It's funny because even as we came in today, I was like, "I'm gonna pull up Maddie's pie chart," because again, in that first time that we met online, like, as I'm listening, I'm creating a pie chart, right? And I was literally, sometimes that's in my head, but I was literally creating it. And as I listen, I go back to those symptoms. It's like, yeah, your nervous system, like autonomic pieces, sensory pieces, there are a lot of things in your story and symptoms that pointed directly to that. And you're right. It's really unfortunate that people have been maybe told some of those things are in their head or they're not real, and it's just that they haven't been tested altogether maybe. um yeah, absolutely right. And you had done a lot of pieces before, and it sounds like it was kind of that like integration that was the difference in
Yeah.
what we did. Yeah,
Yeah, it was
yeah.
definitely bringing together everyone. I've worked with plenty of people individually. Then they'd be like, maybe go see this person, and I go see that person, and go see this person, like it literally being just passed around. So yeah, definitely the team approach.
Yeah, yeah. So let's see, you started your program in December. Is that right?
Yeah, yeah, December
Um,
through January.
yeah, yeah, through January. Okay. And so tell tell me, I know you're back in school and things. What changes have you noticed since the program?
Yeah, so I mean, so there's been so many changes. I'm trying like the most significant one would be like the chronic pain. Because before this, I really was in a state of chronic pain all the time. And I think we like figured out something with the smudging. I don't know the proper word, but basically my neck or my brain would receive a pain signal from one part of my neck, but it would light up pain in the entire neck and go down like my arms and legs and whatever. So the chronic pain cycle, I feel like we stopped it. Like I'm not
Mhm.
in this like it felt severe, like significant amount of pain 24/7, where it's like hard to go to sleep, hard to wake up. It's like, so that changed, which definitely changed the quality of my life, obviously significantly. Um, and then also my breathing is much better. I used the
Mm.
leaf, we used a leaf that like did heart rate variability. I have a leaf at home, and basically retraining my body to breathe better helped
Mhm.
with a lot of the symptoms
Mhm.
in general. Like if I'm anxious or if it's just because I'm in pain or social setting because I have anxiety too. So that helped a lot. And I'm not as sensitive to like noise and sound and movement. Like I had a lot of movement dizziness, motion issues. They're still there, but they're not as debilitating. Like I can drive my car more than 10 minutes again.
Oh, that's big.
Yeah, yeah,
Yeah.
that is big. Um, and my concentration, I guess like my overall mood and like personality is like back again, like I feel more alive and I'm not as fatigued. My mind's not like being drowned by like thoughts of the pain. That's the one thing, it's like your brain, I felt like my brain was obsessed with how much pain I was in. Like it just couldn't break the cycle of focusing on the pain. So we like did a lot of different techniques to bring my awareness to different areas of my body or different sensations because that aren't painful to reteach my body. There's other sensations than pain.
Mhm.
So that's been really helpful. But yeah, I feel like the neck pain really is like one of the most significant things. Yeah.
Wow. Yeah, yeah, for sure. Stopping that cycle, like you said, that was like a really good insight. And you're right, smudging, that is absolutely the word that we use for that kind of sensory map, right, in your brain. So I love that you use the word smudging. I use that word all the time. That's so fabulous. And just tell me a little like life wise. Like you said a lot of things like you feel like you got your life back, your personality and things like that. What are you doing now? Like
Yeah.
what yeah.
So now I'm on spring break. In 9 weeks I'll graduate from school. I only say I'm on spring break because I've been applying to jobs like personal training because
Oh.
since my injury got like began to really interfere with my life, it was really hard to like coach soccer anymore. I had to stop doing that, and I was coaching high school. I had to stop personal training because the weights and the movement, it just was too much. So I'm finally about to get like a short, like small part-time personal training job, which is exciting. So that will just bring more joy and like purpose back into my life. But yeah, and I just do more social things. I don't like stay away from restaurants and I stay away from concerts and being in groups of people or in like area places where there's a lot of people. Um,
Mhm.
yeah, so like I have just more freedom to like live a normal life, but it's interesting for me. It's like my life has changed, but I feel like you don't realize how much you can do until you can do it again, or like how much you couldn't do until you can do it again, or you don't have to think about what's going to happen if you go do it. There's a lot of freedom. That way.
Yeah, gosh, that's like profound. I found myself kind of getting chills with that, Maddie, because you're right. The freedom to work, to do school, to be social, to not um, constantly be thinking about what you can or cannot do is really big, really, really big. Yeah, thank you for sharing that. And you're finishing school too. I think that's another really big goal for a lot of people is to like get back to school or finish school. So tell me about that. And even, were there things in the therapy that you felt like were very specifically helping you get back to meaningful, purposeful things, as you said, like working and social and school?
Yeah, there's a lot of things. Like because the one problem with school is that I would get so obviously it's just like a lecture. It's like me and 10 classmates and a screen and just my teacher talking for 3 hours straight for one class, and there's multiple classes back to back, all on Thursday. So I would there was a lot of things we worked on while I was there, while I was in at Reactive because I was so nervous to go back to school because what would happen is I'd get so stuck in my seat and wouldn't be able to get myself to go on a walk. Like,
Mhm.
uh, I'd get more like a freeze reaction instead of like stretch your legs or um, try to distract your thoughts, like different things like that. So yeah, there's like some things like stretching while in my chair, like just moving my body because I have anxiety too. So like if I let myself freeze too much, it gets overwhelming and then I feel like I need to run away. So
Yeah. Yeah.
yeah, so we, like, worked on talking to my own brain, like, with neuropsych, it was like, "Thank you, brain, for letting me know that you are, um, annoyed in the position I'm sitting in right now." It's like the little things like that.
I love that.
Just, like, joking with your own thoughts because it's like, "Thank you for letting me know you're don't wanna be here right now again." Like, so I worked on, like, being able to leave the room before getting to the point of being like, "I need to, like, run away."
Yeah.
In the room helped, stretching in my seat helped, having a fidget. They gave me a square, like, cube fidget. I play with a crystal in my room, but,
Oh, I like that.
um, the fidget I, like, learned not to, like, hold my movements in, despite what everyone else thinks, because like, I'm a fidgeter, like, I used to try to, like, not move too much, just the social things, whatever. Um, so I just kinda I, like, am more me, I guess, or embrace more of, like, just me and my mannerisms and whatever it is,
Yeah.
and it makes school not as, like, uh doesn't feel as terrible. Because I loved school before all this, I loved school,
Oh,
but then it's not that I hate school, it's just I didn't like sitting there. So, yeah, so we
yeah.
did a lot. I learned a lot. I did so many things.
You did. I feel like you could teach the class, Maddie. That's,
Yeah.
like, so great. And so, you mentioned neuropsychology, you mentioned PT. Tell me a little bit about maybe what were some of your other favorite parts of the different therapies, and maybe even share with everybody like what you do, like which therapies did you do, and what you learned from them.
Yeah, so I did PT, OT, neuropsych, and yoga. And so for physical therapy, I did like I was gonna say typical physical therapy, but it's not. We tried to incorporate soccer because I'm a lifelong soccer player. So we tried to do soccer, but basically we tried to figure out which movements I could tolerate, and if anything, I would try to push myself too far and not, like, say what my symptoms are, so
Mhm.
I like that about it. It wasn't like they let me it's not like I was pushed too hard or, like, not pushed at all. I was, like, met me where I'm at and pushed a little bit, which is a good thing because out of
Yeah.
my own fear, if it was my fear choosing, I wouldn't be trying, new movements anymore. So,
Mhm.
PT was helpful for strengthening my neck and my different muscles in my body to keep that, I guess would, like was because when I run or jog, I get neck pain and a headache, but
Mm.
strengthening muscles that will eventually lead to jogging again and, like, being able to, like, walk long distances, force going up to my neck, so, yeah, that was great, and we did 100 other things, and then oh, the treadmill, we did treadmill stuff, like, on and row machine. I haven't been on a treadmill or row machine in years, so that was, like, liberating for me,
Yeah.
um, but anyway, so then OT, we did it was a lot of the fidget stuff, like, trying to manage my nervous system, and being okay with slowing down and, like,
Mhm.
checking in with myself, brown noise machine when I go to sleep, brown
Mm.
noise sound on when I go to sleep, uh,
Mhm.
helps me get in, like, a deeper sleep, yeah, we did a lot of things, like and then yoga, so I was really scared 'cause, vestibularly, if I went into, like, one position, it would somehow cue, like, every symptom possible, and I'd get, like, panicked. So we figured out ways to do yoga where I could, like, stay in one position and over time, you know, more so gain the confidence that to try, a more advanced position, which would be, like, standing against the wall, touching the wall, and moving. But I can use
Mhm.
those movements now in my daily life, like, um, and it taught me that I'm not as not fragile, but I don't have to be as careful as my brain thinks I need to be. Um,
Oh.
yeah, so the OT helped with that, and then neuropsych, as I said, like, helped with the thoughts in my brain and, like, the pain to the thoughts to the emotions, like, the mind, body, spirit
Mhm.
type of mixture, yeah, and that was, like, a lot of the self-talk, and just, like, being okay where I'm at also, like, meeting myself where I am, which is
Yeah. Yeah, I feel like I literally started taking notes as you were saying things, Maddie, because you articulated that so well. I think you said, "I don't have to be as careful as my brain thought," and I was like, "That's a really good way to put it." So thank you. I tell people all the time, like, I take courses, I read books or, like, research papers, but I learn more from you and other people than anything else. So thank you. I feel like you're giving me a gift, so thank you. Um, now, because we share these videos with a lot of patients that are looking to understand ways they can help their own symptoms. We share it with clinicians. I'm wondering first if you could share what you might say to somebody who is on the fence about doing a program like this if they had symptoms after concussion.
So I was on the fence because I found the Instagram page many, many months at least before I even contacted anybody. I would say if you're on the fence, I had to go over all the things I've tried, and I had to just recognize that all the money and time I've put into so many other modalities and individually and where it got me, and like, did I get short-term relief? Did I get long-term relief? Was it all short-term relief, and for how long? And I had to like really consider how much longer I want to like go into in a circle. And I wanted to,
Mm,
and I had to consider like, have I truly tried something new? And I don't know if I'm wording that well, but I feel like if you've tried all the same mainstream stuff, it might be time to try something new. And this integrative approach, unfortunately, isn't everywhere. Like, I
mhm,
wish it was, but it's so hard to come by. So I feel like for me, like when I found it, I was like, oh, I was meant to find this. Um, so I feel like if you came across it and you have symptoms still, you might as well try. Because I always think like the worst case scenario is it just doesn't work. But if you're on a team, if you're working with a team, something has to help. Something. And for me, like this whole injury, everything has taught me like quality of life. Like it doesn't
mm,
matter if something improves my quality of life by 2%, 10%, whatever it is. It's like just gaining increments changes my whole life. So I get emotional
mm.
thinking about it. But um yeah, so I would say just go with your gut. If you're thinking about it, just do it.
Mhm. Yeah, yeah. Thanks for sharing that for sure, and I think that's the story I hear a lot, and honestly, I'm trying to educate other healthcare professionals and trying to help people set up these integrated programs because it is so needed, and you're right, like, one of the things I love of being about on a program and on a team is that getting kinda stuck as a physical therapist, I can figure it out with people and I get new ideas, right? And we work together, we meet together every week, we figure things out. And I just like honestly don't feel like you could ever go wrong with that. I don't feel like I could go wrong as a therapist in that situation. So you're absolutely right. Now, what also would you share with somebody who's had a concussion who might feel kind of discouraged, like they've been down this pathway like you have, that they can't get better? What message do you have for them?
I would say I would say try to find professionals that are still hopeful for you, because there's plenty of
Mhm.
professionals that won't have hope for you or, like, won't seem enthusiastic or, um, educated or compassionate about whatever's going on, so I feel like, um, for me, like yeah, finding hopeful people help bring me hope again because it is tiring going over your symptoms over and over again and like explaining your whole however many years or months it's been um, to everybody. It's like so frustrating just to get the same result. So um, I honestly, yeah, I would just say just keep trying. Like don't stop because the brain's crazy. Like the brain just can keep readapting. Like it can change and concussions take time to change or to heal already, but doing nothing while it's healing isn't helping either. So I don't know. There's plenty of people that will say like, just accept where you're at. And I'm like, not that I wanted to do that because it's easier, but um, I'm thankful to find somewhere that like didn't let that be the answer. Like you guys had more hope when I got there in December. Brittany had more hope for me than I did internally at that point. And I was like, well, if she thinks I can, I guess I can. So yeah, so I feel like it's finding the good, compassionate healthcare people.
Yeah, yeah, you're right. It's easy to give up hope if you've tried multiple things too.
Yeah.
And I kind of joke that like hope is like our middle name. I feel well, and again, it's not like it comes out of nowhere. We see people get better. We
Yeah.
know that it what's possible. So it's not like a fake hope. It's like a real, genuine thing. That's that's great. I think that's a great message for clinicians too. It's like, why would you even be in this if you didn't have hope for recovery for people anyway? But I wonder what else. Like I said, I've learned so much for you. I'm like taking notes as we're talking, so I feel like you're putting on a clinic for me. Just about what it means to like heal and live, and continue to have hope and move on. What else might you share to other clinicians about concussion and healing and therapy that you think might be helpful for other therapists?
Um, for any type of therapist?
Yeah, yeah,
Yeah, I guess maybe that like everyone's different and that you could I guess that like in your experience you could see somebody not benefit from one modality or one professional from another, but it just seems like everyone gets a different benefit from each type of care. Um, but I would say also like staying like on top of the newest what is it? Like I guess modalities, I keep using that word, but then staying on top of like the newest ways to treat concussions because there are so many people that are so behind and it's like so confusing to like everyone, like the patients, like it's confusing trying to find people. But I would say like working with other professionals, I guess. Like I don't know any other answer anymore because now I'm like it's clearly just work with other professionals so you can all just put your brains together and try to help someone heal. I think people, everyone, clinicians, everybody can be set in this thinking that the brain injuries just stay, like that people
mm,
can't change or improve, or there's a ceiling to it, and it's like it seems like it's it could go on forever, like the improvements.
yeah, yeah, yeah. Well said. I think you're right. I'm a big fan of no ceiling, no plateau, no ceiling. It's endless. I still have like enormous amount of excitement and hope for you for your next steps, for finishing school, for becoming a professional yourself, for spreading the word and continuing to help a lot of people. Like I'm really like truly you are already having an impact on the world. You have on our team, but also just for what's to come. I'm really excited for you.
Thank you, I appreciate it.
Yeah, yeah. And thank you for taking this time to share your story, to share your hope with other people. I think it will really make a difference. And so I appreciate you. I appreciate your time, and thanks for coming to California and hanging with us too and our team. We just so loved it.
Yeah, thank you so much for having me.
Yeah. All right, Maddie. We'll take care and we'll stay in touch.
All right, sounds good. See you.
Okay. Bye.